Ready? Okay. All right. I'd like to call the Thursday, April 6, 2023 Health Committee meeting to order. We have all members present, so we do have a quorum. We have minutes to approve from March 9th in our regular meeting. Do I have a motion? Motion by Johnston, second by Wendt. Any additions or corrections? Hearing none. All in favor? Any opposed? Okay, the minutes are approved. We have appearances by members of the public. We have Vern McGinnis and Phyllis Versteeg. If you'd like to come up to the table, please. And they're going to talk about 377 board.
Good afternoon.
Yeah, on the button on the right.
There you go, red. Good afternoon, and thank you for the opportunity to meet with the Health Committee. Phyllis is the secretary of the 377 board, and I'm the president, and we represent the other three. We have five members, so we appreciate today. Our intent here is to share some information about us that you may not know, and kind of talk about the bigger terms of what is it we are and what are we doing, and we'll be out of here and not to keep you too late, seriously. The 377 board was found here in the 1980s. Went down at Springfield, and they were doing all of that. And so that was in the 1980s. And there were three people on the board at that time, and they were part of the Board of Health. And then I'm not sure when it was, but they went outside that then, and with still the three people on the terms, they had their own board. And that's, you can see how working with three members on a board can be a little difficult sometimes. Phyllis and I joined that board in 2015 when they made the board 5 members. And so we were the 2 on the vacancy with that, and it's that way still now. And so that's where we are. Phyllis is going to start out and talk a little bit about who we are and what we do. And when she's finished with that, I'm going to kind of come back in and kind of close up with some other information. So Phyllis, go ahead.
Thank you. Can you hear me? Good. Yes, we are the McLean County Board for the Care and Treatment of Persons with Developmental and Intellectual Disabilities, which is a long title to say we're the 377 Board. And that's what we do, is we give tax money, we give grants from our tax levy to organizations that provide services from birth to death to persons in McLean County with developmental and intellectual disabilities. We have an open application process, so each year organizations come in, fill out a detailed application, and appear before us and present their application for services that they intend to provide to residents. This year, we granted 5 organizations grants to provide services of 11 different services to persons in McLean County. Those people provide quarterly reports to us. We do site visits, and we feel they are very responsive, and we think they are very good stewards of the tax money that they receive. Also, we are the payer of last resort. So before they come to us to ask for money, they have to have applied and received funds from other organizations before they get money from us. Autism is a developmental disability, and I'm sure we don't have to tell you the prevalence of autism, but it is becoming more prevalent every year, so you can imagine what has happened to our requests. They have been greatly increased. And one of the statistics that we were presented with recently really grabbed my attention. In the year 2000, 1 in 150 persons were diagnosed with autism. In 2022, it was 1 in 34. So that gives you an idea of how much that has increased. The tax money that our board receives really does save lives and impresses a lot and makes a good impression on a lot of people. We have lots of success stories and lots of things that are on our quarterly newsletter and also on our annual report, and those are on the Board of Health, the Health Department website. So we encourage you to read those and hope you get more information. Thank you.
I'd like to tag on to some of what she was talking about in terms of what we really do. And I think the highest priority that we have and the things that we really are focused on is to do the work that goes to the people that have the disabilities. And we do that by giving the money to the agencies and for the programs. And this starts out at the beginning of July and goes right through until we're finishing up with saying, okay, we've got it done, let's send it. The thing that we're monitoring is every quarter, the current money, which is the 23 now, CY 23. Staff are doing that, and they're checking to make sure that things are going well, the money's being used right. Are they having any trouble? If so, how can we help them? And so we're doing that, and then we now are starting to think about, okay, what about CY 24? And so we go right back to where the RPM is, and okay, 2 years ago, we actually improved the process that the agencies had to go through, and it was even better for us about when the applications came in, they were much better than before in that, and so that was a good step for us. What we do then is the applications are sent to the board, and we read them, and then we have a committee, or yes, a meeting, and we go through them all, and we see what's going on and what's in there, and come up with, okay, what questions are we going to have for these? And then we go through 2 days, about half days each, of presentations. So every applicant comes in, and we kind of split that up so it's half and half. And they come in and live, they have 15 minutes to tell us, okay, here's what it is, and here's what's good about it, and here's why you need to afford it, to go ahead and give us money, and how. And after those 2 days are done, then we have what I think is the most significant go ahead and have the same meeting, the best meeting, and that's the 5 of us get together with the staff, and we roll up our sleeves, and we just start talking about it, about, okay, we go through every one of the programs, and at the end of the day, we have decided, okay, these are the ones that we're going to give money to, here's the ones that we're going to give this kind of money, and the percentages vary, quite frankly, and we have the money then from thank you for the money that we get from that. We also have some reserve, and we can go back and come on that. But in one of your folders there, it'll show you we have 3 years there that, as Phyllis was saying, our requests have started to go considerably higher than that. I'm not saying we're here to ask for more money. I'm just saying I think that's a symbol of what's going on out in our community. So we are doing very well with the money that we do have, and the agencies and the people who are running these programs are doing extremely well too. And I think that we're doing what we're supposed to be doing for the residents of this county, and I think we can say that we're proud to do that, and we appreciate it, and we certainly appreciate your support. Thank you.
Thank you.
Thank you. I just want to add that one of the things that they had done several years ago was partnered with Carl, I think it was, at the time it might have been Advocate, to have some of the people with developmental disabilities go out to what's it called? Where they have a pool and they have all that workout stuff, and I can't remember what the name of it is. It really did make a difference in those individuals, in their health, in their overall health.
So it's a Carl healthcare or fitness place
Yeah.
way out east
Yeah.
of town?
Yeah. So it really did make like I said, an overall improvement in their health, so.
I do have a question, and it has to do with the 3-year, page 2 of their document. And it appears to me that they had carryover in this year, so it looks like they're spending down and having less carryover. Is that accurate?
That will be something we'll have to review with Amy Hancock and Health
Yeah.
Department staff. We received this notice the same time you did.
Okay, it just, as I look at it, their carryover, their reserve is significantly less, and I was trying to do the numbers, and it appears that they used some of that for their funded programs, so I was just wanting to check on that,
Yeah,
so.
I'd have to look at the CAFR to see what they had over the last couple of years for reserve that didn't all get spent. Sometimes
And you know me, I don't like a
I
lot
know
of
you.
reserves,
Yeah.
so
No, they
that
have
looks
very little
positive.
reserves.
Yeah,
They really do have very little reserves.
yeah, but thank you. I'm sorry.
Yeah, we'll get back to you on that.
Thank you.
But this is, a lot of the same process goes through for the mental health on the 377s, on the 533 side of the Board of Health. So same type of process that we go through, but that one's just kind of quiet, so. Next up is departmental matters, advanced correctional health care, and
I've been in communications with Diane Hughes, and we will not have a report for tonight. We will have a report that will be sent to you, to the committee, and they can review and discuss that next month. They'll have 2 months to discuss next month. We will have 2 new staff, including a manager starting on Monday. Jessica Hand and Cassie, don't have a last name, who's our HSA. She starts on Monday, and so they will be presenting next month, those 2 months of reports.
thank you. Next up is Jessica McKnight, Health Department Administrator.
Hello.
Hi. You have no items for action, so.
No items for action, but happy to answer any questions that you might have.
Member Johnston.
More comment than, and I guess it is a quick question. I did take a chance to read through your annual report. It's very well written, lots of detail. It's hard to be concise with the amount of services that you guys provide. When I went, but PDFs don't post very well to social media. So when I went to go try to find it, it wasn't right on top of the health department page. So if there's a way that you guys can move that, because you guys put so much work into summarizing that nicely, lots of good layout. It would be great if we could have a very quick access to it. So.
Good feedback. We are currently working on revisions and updating our website. When we shared to social media, we shared right directly to the page that it's on.
Excellent.
Good
Okay.
feedback. Thank you.
Thank you.
Any other questions? Anything you'd like to highlight?
I don't think anything to highlight. Yeah, a lot of work in the last couple years, and still, it was surprising how much COVID still we were working on in 2022. It didn't feel like it, but then when going back and reviewing everything in the last year, there still was a lot of impact and response from COVID.
Member Metzger.
I know last night we approved, you're going to have a health fair coming up, I believe. You're working to provide a health fair to the employees, so I know that's upcoming, and I wanted to applaud you for bringing that back. I think that it's important that we provide to our employees of this county all the possible services and information that they can have that will improve not only their own health care, but also they can share that with their families. So, thank you.
I'm definitely excited. It'll be the first one I've actually been to since being a McLean County employee. So I think our staff were excited to start preparing that and working with the city. And I think staff overall are excited that it's coming back. So thank you.
Chairman. Happened to see the health department had a presence at the Transgender Resource Fair last week. Was very pleased to see that there. So going along with that, congratulations on that. Thank you for
Thank
that.
you.
Anyone else? Okay, thank you. Next up, Tim Wiley, Nursing Home Administrator.
Hello again.
Hello. You have an item for action, request approval of a service agreement with Elevate Therapy Consulting Group Incorporated. Do I have a motion? Motion by Byrne, second by Biles. You want to explain that one?
This is a colleague of mine that is going to be able to provide for us some assistance in our reimbursement rate with Medicare and Medicaid. I don't have any projections for the potential with Medicaid, but he and I have already set a goal for targeting an additional $50 a day for each Medicare resident, which if we maintain our goal of an average of 8 Medicare residents per day, that would result in close to an additional $150,000 in annual revenue just from the Medicare line. They would be assisting us in best coding and documentation to improve reimbursement.
Coding is important. Anybody have any questions?
Yeah. How many Medicaid patients do we have?
Medicaid,
Yeah, Medicaid.
we currently have 47 out of tomorrow, it'll be 103 residents.
And
We have
how close
99 today with 3 to 5 admissions scheduled
How
for the month.
close is the Medicaid payment to our private charge?
They're the same.
What?
They're equal.
Oh, they're equal now?
Yes, sir.
Well, that's amazing.
Yes.
So it doesn't make any difference anymore. Okay. Oh, curiosity, what is that rate? I'd forgotten. Is it
The base
87?
rate is $224 a day for state Medicaid, and it's a little bit higher than that for what they call managed Medicaid. And currently, our private pay rate, I want to say, is at $240. So between the managed Medicaid and the state Medicaid, which of our 47 Medicaid residents, I believe only 6 are state Medicaid, the other are managed Medicaid, it balances out.
Well, that's good.
Yes.
Just a quick question. For the contract, it looks like this is like a consultant type contract. What's your kind of expectation for like how often or how long this contract might be used for?
I appreciate that question. A little bit of backstory and my objectives here. Since the county home and since the county does not have this resource, I'm trying to recreate what would be similar to a corporate infrastructure of resources for the home with consultants instead of having a company regional director of operations and a corporate nurse and a financial controller and things like that. So they would be the equivalent of a reimbursement, like vice president of reimbursement in a corporate structure. Their person will be our phone a friend for our MDS coordinator, which drives our reimbursement. I intentionally set it up as an hourly rate rather than a monthly fee. So early on, I would imagine we'll be using this person quite a bit to help us establish new practices and educate us. And then over time, with that hourly rate, it would allow us to go extended periods of time without needing to reach out to them.
Thank you.
Member Metzger, did you have a question? You got a look on your face that,
I think my question is not going to be related to this. I'll ask that question. It's related to a discussion we had yesterday at Finance. So,
okay, so any other questions on the contract? We haven't voted on it, right? Okay. All in favor? Any opposed? Okay, that passed. So now we have the monthly report.
A few things I would just like to draw your attention to. I know you have it and you've already read it. We're excited that our agency utilization is down to 15% of our total nursing shifts, that as of February 28th, our annualized turnover rate, which just as a point of perspective, in November of 2021, at the end of 2021, our turnover rate was 67%. At the end of '22, it was 47%. And actually, I'll give you a little preview. As of March 31, our annualized turnover rate for 2023 is 37%, but it was 30% through the month of February. Speaking of February, I just want to point out some other progress that we're making that took place in the month of March. So it's not in this report, but I think it would interest you, and that is relative to our aging. We have put some new aging processes in place, collections processes in place, and if you were to look at page 57 in your report, you would see that the balance as of February 28 for aging, and there's a lot more that goes into this, but just to let you know the progress, two things, that 4.4 million includes 2.8 million. We're currently working with the county on addressing that old aging, but that $4.4 million balance as of February 28th, as of April 6th, is now $633,000 less as a result of March's efforts.
Excellent. That's excellent. And that's with the company that came in?
They have not started yet.
They have, oh, this is just on our own work on this.
This is the administrator and the biller.
Okay. Any questions?
my question was related to that. We had some numbers yesterday, and I just wanted a little clarity, and you provided that, so thank you.
Okay.
Anyone else have any other questions? I'm glad to hear that the census is up over 100.
It's 99, we were at 101 yesterday, and then we had what we compassionately. We were at 101 for a period of time yesterday, and then we experienced what I compassionately refer to as some divine discharging. And we're at 99, but like I said, we have either between 3 to 5 admissions scheduled for tomorrow.
I have one question. If I recall correctly, Heritage sold some of their facilities to
Correct.
another agency. Were any of those in town here?
Yes.
And has that impacted us at all? I would hope positively.
We believe anecdotally, not scientifically, but anecdotal evidence would indicate that it's not only helped us with some, our private pay census is 37. A month ago, it was 27. So we think that there might be some census impact, but we already know that it's helped with our staffing.
That's good. Thank you. Anyone else? Thank you. Next is the report of the county. Sorry, Jason. Next is Jason Tabb, Juvenile Detention Superintendent. It's like, started talking about Cassie, and I'm like, oh, wait a minute, Jason stood up.
Good afternoon. I have no items for action. You do have my report. I'd be happy to answer any questions.
Any questions? Thank you.
Thank you.
Okay, so now the county administrator, Ms. Taylor.
All that build up, and I have no items to present for action. I will commend the nursing home for reaching that milestone of 100 with their census and for their efforts on aging. I will also share that anecdotally, I received a message from a former county administrator who was on social media and saw a question about our local nursing home and the care received. And at the point where he had reviewed that social media content, there were 30 responses and they were all positive on the care that was received. So I thought that was a wonderful thing to share. And of course, I shared that with our director of nursing and our nursing home administrator and passed that along. I also commend Jessica McKnight for bringing back the employee wellness fair. We have received many positive comments on bringing that back.
Thank you. Other business or communication? Our next meeting is May 4th at 4 o'clock. Does anyone else have any other business or communication? Okay, if not, it's time for the fun part. We have bills to pay, and the auditor has reviewed them, and they comply with all of our ordinances, resolutions, and policies and code. Which way are we starting here? Okay. The Board of Health has a prepaid total of $331,656.30. Motion by Johnston, second by Metzger. All in favor? Any opposed? The nursing home has a prepaid total of $786,005.09. Motion by Metzger, second by Went. All in favor? Any opposed? Okay. Jail and JDC Medical have a prepaid total of $265,860.14. Motion by Went, second by Byrne. All in favor? Any opposed? Okay. And the Developmental Disabilities Board has a prepaid total of $68,158.37. Motion by Byrne, second by Biles. All in favor? Any opposed? And with that, we are adjourned. Thank you.